So patients with SI joint dysfunction or hypermobility do a modified workout. If you have EDS and a hypermobility disorder that is quite common, believe it or not, your best bet for exercise is horizontal exercises. Yes, I know that sounds ridiculous, but horizontal exercises like rowing, Pilates, table exercises, swimming. So my Pilates reformer here is something I use with my patients all the time. That stuff over there, all that boring stuff, is stuff I have people do while laying on the mat. And the mat exercises also apply to SI joint dysfunction. So with my patients that have hypermobility and SI joint dysfunctions, I like to say, let's do the basics well. We start with exercises done lying on your back, and we make sure that we can do those, such as working on abdominals, bridges, which are for the glutes, exercises lying on your side, exercises laying on your stomach, and we start with your body weight and learning how to control your limbs through that motion. So a bridge with a ball squeeze is one of the most popular things I give my patients to do. The ball between the knees as you squeeze it and bridge is to help you fire your adductors. You can also engage your pelvic floor, then engage your abdominal muscles. And as you lift your hips up, your glutes are firing. And yes, we are specifically asking you to engage your pelvic floor and your transversus abdominis because it's very important. But really what's the most important is that we are making you fire muscles and move your body and not being afraid of the movements. So I tell my patients to stay within their pain-free range. We also do abdominal strengthening. My ebook that you can get for free in the bio here is for women with diastasis recti, split abs. But let me tell you, the same protocol is being used right now with patients with EDS in my clinic. We are actively doing research on that. That is a great way to learn how to fire your abs. It is a great way to help your SI joint. But overall, we need to move our bodies, but I don't want you to be afraid. And knowing what you can do is helpful. So I have a ball, you'll place it between your knees. We'll do a ball squeeze and a bridge. Now, if it hurts you to do a bridge, don't lift as high. Stay within your pain-free range. Next, what I would have people do is engage their abs, but we always start with breathing. So now that you've done 10 breaths and you have focused on breathing, and I really care about your exhale, now on your exhale, as you are blowing out, I'm gonna have you engage your abs, drawing that lower abdomen in. If you wanna know more about that, get my ebook in the top there. So if you can do the basic abs, then you progress along. This is technically called dynamic lumbar stabilization. I mean, it has been used for years and years and years, but it still works. Now, based on how my patients are feeling, that is a beginner SI joint program that many physical therapists will use. And what really matters, remember, is being consistent and moving your body. I care more about your activity level and finding a place in your life to move than specifics. But with that being said, I do need you to learn how to fire your abdominals. Now, believe it or not, my bendies still do bicep curls and still do rows. Maybe they start with a 2-pound pink weight, but then they progress usually to a 5-pound weight. Now, when you get better with your SI stuff and when you get better with your table exercises, you can progress to upright exercises. And I really, truly believe a 5-pound weight, this is a kettlebell, you could do a mini squat, clutching that weight to your chest and going down just a little bit. Imagine your butt hitting the seat, but you might not even be able to go that low. Eventually, I have people progress to deadlift, yes, but with a kettlebell or a weight that they can tolerate. And so they would hinge at their hips and back up. Because when you unload the dishwasher, you're doing a deadlift. It's functional.